Namaskar and welcome to Apollo 24/7's Health Hour. Wishing you all a very happy Women's Day and Women's March. This is entire month is celebrated as Women's March. So हाल ही में हमने Women's Day celebrate किया था 8th of March. So here we dedicate this episode to Women's Health Guide, all the myths, all the diseases, diet, and other things revolving around women's health. And today on the show, we're going to have two experts who are going to join us very shortly. And on the show, we do have a health quiz where you can participate and win gift vouchers from Apollo Hospital. Also, we Apollo 24/7 gives you out discount vouchers and gift vouchers to use on Apollo 24/7 app. So download the app and get all the benefits. So here we are with our topic that is Women's Health Guide. I love the image of the woman sitting happily, joyously eating good food and exercising, happy and a healthy woman represented there. I want all the women there, and we have our experts joining us right now who are going to get you there, give you all the tips and the roadmap to take care of your health. Let me invite our first guest of the day, Dr. Anuradha Panda, who is an obstetrician and gynecologist, laparoscopic and robotic surgeon from Apollo Hospitals, Jubilee Hills, Hyderabad. Ma'am has more than 27 years of experience, and she can be consulted for PCOD, infertility, high-risk pregnancies, recurrent abortions, heavy menstrual cycles, fibroids, ovarian cysts, and endometriosis as well. And she's the professional member of Federation of Obstetric and Gynecology Society of India, and Indian Society of Perinatology and Reproductive Biology, Indian College of Obstetricians and Gynecologists, and IMA as well. She is very well awarded, and her achievements range from Inspiring Gynecologist of South India in 2019, Legend of the Year in 2019-20 of the Times Healthcare Achievers, Golden Aim Award for Excellence and Leadership in Healthcare 2022. It's my honor and privilege inviting Dr. Anuradha Panda to the show. Good morning, ma'am.
Namaste. Good morning,
And
Nancy garu.
happy Women's Day to you, ma'am.
Thank you.
Thank you. And just hold on for a bit, ma'am. Let me introduce our second guest and we'll continue the discussion. And today we have a very, very senior dietitian joining us on the show. Let me invite Dr. Bhuvaneshwari Shankar, a senior consultant dietitian, Apollo Hospitals, Grange Road, Chennai. And Dr. Bhuvaneshwari, ma'am, has 40 plus years of experience in her field, and she can be consulted for clinical nutrition and dietetics. She is a member of Indian Dietetic Association, Nutrition Society of India, American Society of Parenteral and Enteral Nutrition, European Society of Clinical Nutrition. She's been awarded with fellowship from ICAR, Teachership in Clinical Nutrition, the European Society of Clinical Nutrition. And I think she's been here with us for many episodes. Let me welcome Dr. Bhuvaneshwari, ma'am. Good morning, ma'am.
Good morning. Good morning.
Always good to see you on the show. Welcome, both of you.
Thank you.
Happy Women's Day. And I think, thank you, ma'am. It's very, very important for our women to be happy and healthy. Both of them are interlinked. So let me start with Dr. Anuradha Garu. What do you think a healthy woman or a happy woman needs to do? Take charge of what?
She needs to take charge of her life, I would say. And that is what we say Women's Day. But that's how a woman gets empowered. And I always feel that knowledge and awareness makes her more empowered than just saying that she's empowered. So she needs to know what's good health, what is bad health. She should be knowing what are the warning signs so that she can seek help. That's only from the health point of view. But she needs to have a good diet, to exercise, and those are the most important thing. A good mental health, even that's now important. Now most of us as women are multitasking every day. We hardly give time to ourselves. I think that's very important that we give some time to ourselves. Apart from doing our work, we stay mentally and physically fit as well. And even
Wonderful.
dietitian, I think madam will tell us that's a very important part of our
Absolutely.
lives.
And she's bang on, spot on with her yards. She has a stick, nice one-liners that she'll give, and you'll never be able to forget what she's given you. And I love Dr. Bhuvaneshwari for her sharp wit and very really useful tips that she gives. So, Dr. Bhuvaneshwari, we all know that you being a consultant dietitian, you know that all the women think that their health is equal to weight. So you always reduce our burden by not thinking of weight. So, how do you want to cancel the equation? Health is not equal to weight.
Um, First, I would like to say Happy Women's Day to all the
Thank you.
women. One liner you were asking me, I want to say, please become selfish with regard to your
Selfish.
diet, your exercise. Always, we think we are there to take care of our family, not us. We put ourselves at the back seat. I tell the women, take care of yourself. Automatically, you can take care of everybody. If you're sick, you're the fulcrum of the family. Everything will go haywire. For that matter, become selfish. Have a me time for your exercise. Don't eat what is left over. Your stomach is not a glutton. Please eat proper meal. This I would like to tell. Okay, you were asking health and weight. I agree. Overweight causes concern, underweight causes concern. We should try to aim at ideal weight, but weight alone is not health. There are a lot of other things. People go on crash diets, go on fasting, and get into a lot of other issues.
Yes.
So don't look, I mean, I keep telling women that if you have to conceive, you need fat in certain areas. I'm sure the gynecologist will agree. You cannot be malnourished and then conceive and then deliver a healthy baby. So it will take time for you to lose weight. So your look alone doesn't matter. Your health, fitness matters more. Yes, looks matter. You can always make yourself look better if you become selfish and take care of yourself.
Lovely, ma'am. So, Dr. Anuradha, while we talk about women's health, most of us, including, very well educated societies, think that women's health means only reproductive health. And, we revolve around a gynecologist when we talk about women only. That's when I keep saying that you gynecologists are the gatekeepers of women's health because you are the ones who branch them out. Boss, this is what you're going through. And in your practice, I'm sure you must have seen a lot of cases where women reach out to a gynecologist than any other physician first.
Yes. I would say gynecologists, many times we are the first point of contact. They come to us when they, what you said, they, it concerns reproductive health, but it's not so now. Now people, women have become more aware. That's why they need to be aware to know about things. Previously, you have the older population saying we went to the doctor when we were pregnant. That's all. After that, we never been to a doctor. They haven't undergone a single preventive check. Neither they have done a pap smear ever, a breast examination, a mammogram, or health check to know how they are. They never even check their bone health. They think it's only what you said, uh, reproduction which gets them. But they should know there's many things beyond, and they have to come to a doctor when they find problem in their cycle. When they actually they should come to a doctor even before they get married or preconception, before they plan a
Correct.
pregnancy. They should be there with the gynecologist to know, and that is the time we screen them, because to have a healthy baby also we need a healthy mother, so they shouldn't have deficiencies. Post that, they need to know how, if they had some hypertension or diabetes during pregnancy, they should be told that these are the disease, that is the time when the mother is at stress. So when she has diabetes or hypertension during pregnancy, she's very prone to have it very soon. So she has to maintain a strict diet, exercise, so that she can ward away the disease. Maybe she'll keep it at bay a little longer. That's the second
Okay.
thing. And post that, whenever she comes, a young girl also, we should be telling them about vaccination, about
Correct.
HPV vaccination for the woman. That's something important. We need to tell them to prevent cervical cancer. That's the most important vaccine. And then post delivery, we need to tell them how to get back to shape. Even that's a important thing. What they haven't done, they should continue. And once they grow a little older, they need again all those preventive checks. They
Right.
need to take
Right.
a pap smear, they do a breast exam, they need a mammogram, they be a BMD, all these they have to be checked. And again, they should be aware there's something called menopause. They should be even aware of that. Once they get those symptoms, they should know what are those symptoms and come and seek help. And now with advancement medical science, we have treatment, we have many things for all these conditions. So women did not suffer in silence. I would say, women should not
Wonderful.
suffer in silence. They should be aware. and then come seek help.
Absolutely, ma'am. Awareness, and that's the reason why we are here talking about very important for a healthy nation, for a happy nation. We need our women to be healthy and happy too. So, Dr. Bhuvaneshwari Garu, with you, I would want to start today's questions off because here's a question. I have gained weight. I gained 20 kilos, like probably from 60 kilos to 80 kilos. There's fat around abdomen. I don't have the age of the participant here. How can I manage? Can excess dietary intake cause weight gain?
Of course, excess calorie in any form can cause weight gain. Calorie burning reduction, that is, they don't go for regular physical activity. Not necessary
Yes.
that they need to join a gym. At least half an hour to 40 minutes of walking, even if they can't do it at one stretch. And then mindful eating. That doesn't mean you have to diet, doesn't mean that there are a lot of no's. There is yes also. So things in moderation. I would say please consult a dietitian, chart down what you can eat, how much calorie is required for you, and what are your foods which you like, which the dietitian will allow in what quantities, and your exercise pattern. Both will help you lose weight. But putting on
Consistency
weight took some time, so don't expect weight loss immediately. Crash diets will make you lose weight and health.
and health.
Yes.
Wow, I like that last line. Crash diets will make you lose weight and health. That's why I keep telling. ध्यान से सुनो डॉक्टर भुवनेश्वरी को लिख लो वन लाइनर्स या coming back to Dr. Anuradha ji, here's a question. Soma Vishwas, 35-year-old female, and request to all the viewers, please write down your age and any other health problems also. Do not give me just a question. It will help our experts to get a proper answer for you. Soma Vishwas is a 35-year-old female, and how do I manage extreme mood swings during my periods? I think this is important with that we talk about mental health and other issues which can create, mood swings and other disorders. Maybe, ma'am, you should talk also about postpartum depression along with the periods and mood swings, ma'am.
Yes. So when you ask that, ma'am, we should know about the menstrual period. There's a menstruation, follicular phase, ovulation, and the second part is the luteal phase. The first part of the cycle, you have more of estrogen, you have FSH, which makes your mood better. You feel more
Yes.
active, you feel better, you feel more energetic. Then it's the ovulation phase. That also makes you feel better. Then after ovulation is the luteal phase. And that's the time when the estrogen may be little less, the progesterone rises. And that's the time when you may have mood swings. Sometimes people may have a little bit of depression and they maximize just before the periods. Okay, her question was,
Mood swings
what can I do?
during 35, and how do I manage extreme mood swings during periods? I don't think it is during periods, but it must be a
This
little
period
ahead of
just
a
before
period.
periods, yes. First, I would say is a lifestyle management. Do a lot of exercise. That will elevate your mood because you have good hormones released when you exercise. That makes your mood better. Number two, abstain. Don't take too much of coffee, tea, and all that. That also, coffee is known to cause more of mood swings. And sometimes when it is too much, it doesn't go with that, then maybe you may have to seek help. We may give you some vitamins and minerals. Sometimes we even check your thyroid and other hormone levels. Even those vitamin D deficiency, thyroid, sugars, they also should be checked. Sometimes they may be if when they are treated, also you may feel better. And still, if it doesn't, we put you on some medication which may not be hormones, but they are something like vitamin E supplements, omega 3 fatty acid that can make your mood better. Very bad, there are something called dysphoric symptoms. Those have at extremes, and those happen in people sometimes if they're more prone for depression. We know that. Apart from depression, anxiety, and all that, so maybe you may have to take a little bit of counseling. You may have to take a little bit of counseling for that, and mild medication may be necessary, but those cases are very few and far between. Mainly, it
Yeah.
can be done with your exercise and lifestyle change and dietary changes.
Wonderful. So this is about a woman who's in a healthy cycle. But how about all the postpartum depressions and the mood swings or other anxiety syndrome in a new mother? the postpartum depression?
Those are actually what we term as postpartum blues. So uh, most of them won't. There are people who are very anxious, who get very anxious, they get strained, and sometimes what happens when they don't sleep well at night, they some that also aggravates. So they have anxiety, they have depression, they have mood swings. So most of these people, again, they will need family support, I would say. Family support will go a long way. So the mother-in-laws, husband, mothers, they should put in a little effort, give her little not make her too anxious. Sometimes they feel, okay, my breast milk is not okay. I'm not able to take care of the child. Those are the things, and those who are a little more prone for being too much anxiety and tense, they also they show those symptoms more. But these are known to happen, and I think with little bit of counseling can also go a long way, support, and most of them will not need any medication.
Yes, wonderful, ma'am. So, coming to you, Dr. Bhuvaneshwari Garu, is there a link between what you eat or your pre-period phase that doctor was telling us? Is there any particular kind of food that you would want us to advise eat at that point of time or avoid? I go into cravings just before my period. That entire week, I see that I'm craving carbohydrates badly. So, anything that you have up your sleeve?
Yes, people do come with carb craving. I would say choose healthy carbs. I'm not telling don't take carbs. Carbs are not bad. Take it as fruits instead of sweets. See, the difference between fruit and sweet is fruit has carb, it has fiber. I wouldn't
Ji.
say it's fantastic healthy carb. Instead of juice, take it as a fruit which has fiber. Okay?
Ji.
Instead of the juice. Same way, instead of the sweet, when you choose a fruit, at least the fat bit you're avoiding. The calories
Hmm.
less. And like it soothes your mind, and drink plenty of water. Avoid fried foods and high masala foods. I'm sure one will not feel like eating. And second, small
Uh-huh.
frequent meals. Instead of eating too much, already you have pain everywhere, or your mood is off because of different hormonal actions. Added to that, if you order a food from outside, eat, and then that causes stomach concerns. So choose the food which are comfort foods. Don't overboard on sweets. And as doctor
Right.
said, exercise gives you happy hormones. Look at other ways of handling it, not only food.
Correct. Exactly. So keep moving. Working out is the best part of that phase, especially. That's what has helped me. Yeah. The next question I would want to move on to is Bhavi. Dr. Anuradha, yeah, what are some of the recommended vaccinations and booster shots for women, especially? And what are the time that we need to take them? Any supplements like omega 3? No, no, I'm sorry. But did I confuse the question? Bhavi's question is here. What are the time that we need to take these shots? Any essential screenings like pap smear and their frequencies? So I think this is the time that we talk about screenings of women in different age groups. Bhavi's age group I don't have here, so maybe we can start from the 20s, under 20s, 20 to 40, and then
Yes.
40 to 60.
Okay. We will go by disease. The C is asked about HPV vaccination and pap smear. So we talk about cervical cancer first. That's the fourth commonest cancer in the world and the second in India. Okay.
Oh,
And now breast cancer has come down in India because of screening and
correct.
vaccination. Well, what is
Correct.
screening? Screening is detecting the disease early. So, the most important thing when we screen for cervical cancer, it is a pap smear, it is a HPV DNA or a co-testing, which when we include both the pap smear and the HPV DNA. So, when to start screening? If you ask, different guidelines say different things, but we have to. The guideline says once a woman is sexually active, we can start screening, but at least by 25 years, 25 to 30 years, we say only pap smear. Below 30, we don't do HPV vaccine. Don't do a HPV test because in
Test.
youngsters, even if you get HPV, it gets washed off on its own. It gets
Oh,
eliminated from the body. It's only after 30 that we start doing the HPV. So after 30, you can do only the pap smear, do it every 3 years. Or if you're doing HPV vaccine with a pap smear, there's a co-testing, do it every 5 years. And sometimes now recent many studies show even a pap smear can be done as a primary thing, and do it every 5 years. In India, we follow the pap smear first, pap smear plus HPV DNA. That's how we go. And you can do it in 64 years. After that, you did not screen. That's for a woman who has been screened 2 to 3 times earlier and the test is negative. For example, we find many women in India, as I told in the beginning, who have never got a pap smear done. They come to you maybe at 65 for vaginal itching. Catch hold of them, do a pap smear.
Hmm.
Then coming to the vaccination, well, she asked about HPV vaccine. Yes, even now government of India has come with a vaccine. Most they'll start giving it along with the pediatric age group. But how we give a vaccine is 9 to 11 and 15 years. And when it is below 15 years, we give 2 shots of the vaccine. We have a quadrivalent vaccine and a nanovalent vaccine. For a girl less than 15, we can give only 2 doses, 0 and after 6 months. But if she is from
Yes.
16 to 24, that's when we say the catch up vaccination, the 0, 2, and 6 months. After 24, well, we can give them a vaccine. Everybody says, like all this marketing, they say you can give it till 45 years. I mean, the woman should actually have when she comes, when we give it after 26 or 30, when the woman is older, we don't know how much effective the vaccine is. Actually, it's better when you take a vaccine before sexual exposure, because
Right.
HPV vaccine is known to, I mean, come through sexual contact.
Trans. Yeah,
So,
transmit through sexual.
yes, sexual contact. So, HPV being the most important cause of cervical cancer, get vaccinated. That's one. And
Right.
other vaccines, what she asked, other vaccines, the routine vaccine you will be taking. And if somebody wants, we check for a rubella antibody before somebody, if somebody comes for pre-conceptional counseling, before getting pregnant, if they come, we do a rubella IgG. If she is negative, we can give a vaccine for rubella. And then we tell her not to plan pregnancy for 2 months at least, and then she can get pregnant. And other vaccination as for all adult vaccination, hepatitis vaccination and varicella vaccination, influenza and all we give to senior citizens. And the rest of the vaccine everybody takes. And when in pregnancy, now the tetanus is what we give, and we now start giving Tdap vaccine or Tdap. There's a diphtheria also and pertussis. That's a
Wonderful. So
combination
that's about
vaccine.
vaccinations, ma'am. Can we also quickly
Yes.
talk about the screening, other tests that one has to take, a woman especially has to take in multiple age groups? For example, me between the age group of 40s to 60s, how important is it for me to screen for other disorders and other tests like bone density हो सकता है, vitamin deficiencies हो सकते हैं.
So first thing, when you say cancer, the other thing is the breast cancer, which is now becoming very common. And for that, we do a mammogram. That's how we
Mammogram.
screen for breast cancer. But you can also do ultrasound. There's another mode of screening, MRI. But the most popular one is a mammogram. And not to forget the self-examination. All women should self-examine the breast. Do it after the period when the breast is more supple. If you do it before period, you'll have lot of nodularity, you'll get confused. And you should examine your breast so that you know the texture of your breast. So you find any new lumps or any areas, any nodularity, go see a doctor. And the doctor can also do a breast exam. You are less than 40 years, usually with no other family history of breast cancer or ovarian cancer, colon cancer, we ask for ultrasound before 40 if you need one. But from 40, we start doing the mammogram. 40 to 45 is optional. If somebody wants, they can go. But from 45 to 54, it has to be done yearly. After 54 to 65 or later, she can do it every 2 years once. Then about your
Okay.
bone density, we do a BMD, bone mineral density. That is we do a DEXA. That is a kind of X-ray which is done for the lower spine and hip, and they calculate the score comparing to healthy young individual. And depending on the T score, they tell you if you have osteopenia, that is low bone density, and osteoporosis, which will need treatment. But some women are more prone for having what will you call less dense bone. Like if you are athlete, you may have less dense. If you are thin, less fat, you will have less of density in the bone. And sometimes smoking, alcohol, all those will reduce. If you have some thyroid disorder, you are on steroid, you have lupus, all these women have to go for BMD earlier. But
Okay.
women, like normal healthy women, maybe after menopause or at 60, you can start doing the MRI. I mean, doing the
The
DEXA.
bone density.
And your doctor
Yeah.
will advise you, yeah, about that.
All right.
And for ovarian
Great.
cancer, if you want, I mean, if you have
Yes, ma'am.
anything,
Please. Yes, ma'am. We
ovarian
can take up.
cancer,
Please continue, ma'am. Ovarian cancer. I
ovarian
think we should continue.
cancer, I mean, if family history of ovarian cancer, you need to do a transvaginal scan from above. When you do it from the abdomen, many a times, if you're a little obese, your ovaries cannot be seen well. So we go with a TV scan and CA 125. That can be done. And somebody with a family history of cancer, we send you for genetic testing, BRCA and all that. I mean, I don't want to go into all that. When you have cancers in the family, consult your doctor. They'll advise you how to do. And maybe when you somebody has early onset breast cancer, you may even have to start screening at 35. So depend on individual age, seek help from your doctor. They are the best person to tell you.
First and foremost, be aware and do not hesitate going to a physician or these tests. So, as you were mentioning, that having awareness of your own body is very important. Well, Dr. Bhuvaneshwari ji, 3 to 4 questions are waiting for you here. The first one is, सबको तो आज आपसे डांट पड़ने वाली है first. Please pardon them for asking these questions. The first one is Shikha, who is asking that she's a principal, she's working as a principal, doesn't have time to exercise, and I don't have proper sleep. Currently 85 kilos, I'm trying to lose weight, but I'm not able to perfectly balance my diet, exercise, and sleep. That is one. Two is Vishakha, 31-year-old. How can I manage my weight with so much of high intake of carbohydrate in an Indian diet? Because chapati, paratha, rice, bread, puri, whatever you call, there's too much of carbohydrate. And Shubha Nair is asking, working women who are struggling to take care of our own health, while you say that do take care of your health, deadlines and household chores, how do you think I can manage my weight? So all of them together, आपने जैसे बताया है कि selfish कैसे बने?
Uh, I know it is a struggle, but what I would say, incorporate exercise into your daily routine, even at office. Climb upstairs if you can, and instead of picking the phone and talking, go to the next desk, whichever desk you need to. And I tell people, do not use lift in your office if it's one flight of stairs or 2 flights.
Yes.
Okay. If she is a principal, let her go for rounds more often. Counter steps.
Ah,
People will be very scared of or quality conscious they'll become. The principal might come anytime. Not necessary that you have to be sitting and
make
administrating. If
use
you
of
have
your position.
Yes, you have a college or you have a office from one building to other building, keep walking. First, count your steps. How you count your calories, you can always count your steps. You don't need a pedometer. Just have your mobile. All of us carry a mobile, put it in a sling bag and walk. It
Correct.
does. And I'm telling you, if you want, you will find at least 20 to 30 minutes in a day for your exercise. Do we bathe? Do we pray? Do we brush our teeth? Like that, this should become a part. And the apps prompt you. The really apps prompt you saying, today you have not reached your target still. So you can download such apps and do. This is about exercise. Second, yes, our households are having a lot of carbs in our dishes. But cut down the carb. Cut down the. I'm not telling don't eat idli, don't eat dosa, don't eat rice. I do not advocate something which your routine is. If I am used to eating, I will say make puri for your kids, make it into roti for you so that you can cut down oil. Cut down the number of rotis or the quantity of rice. Do not start your meal with carb. That's the biggest mistake we do. And if you have long gaps between breakfast and lunch, by the time you hit lunch box, you're so hungry that you start gobbling food, and that too carbs. So have mid morning in between, whatever is suggested. Keep drinking water, fill your stomach before eating. Do not go to a wedding or a party with such hunger. Yes, you need to
Yeah.
enjoy food, but fill your stomach a little and then go. because we, after all, we're all human beings. We get attracted, and after seeing the plate, it's very difficult to control. So
Yes, yes.
pre-plan your meal, what you're supposed to eat. I think I've answered all the three people's
Yes,
questions.
ma'am. In one go, you have answered all three. So it is about how conscious you can get. So be aware from Dr. Anuradha Panda and be conscious from Dr. Bhuvaneshwari. So with that, we would you want to add something, Dr. Anuradha? Because we are all women who are juggling with our work and our professional life to being healthy. What is your personal advice, here, ma'am?
I think exercising is a habit. If you make it a habit, at least 20-30 minutes, I think we can spare. From our busy schedule, we can spare at least 30 minutes to go for a walk, and that makes us feel better. That's what personally I feel. At least when you
Yeah.
go for a walk, you feel much better after coming back. And I think other things can wait a little. As madam said, diet, yes, when you're hungry, you go gobble whatever you see on the plate. It's better we keep fruits or nuts or something ready. When we come back, when you're too hungry, we can binge on that rather than going for carbohydrates, unhealthy snacks. A little difficult, well, but I think we can make it a habit. I think it should be a habit. A little bit of
Yes.
exercise should be a
It's
part
all
of our
about habit.
routine.
And I would add something here that, whenever that you start to go out on a walk, that is your me time, ladies. Make sure that you guys are getting out of the home. Your responsibilities will automatically fall in place. That is your time. Go out, step out. You will have your, that time to walk as well. So, ma'am, next question that I want to take is Maumita Dash, 34-year-old female. Is it possible to get
Hmm.
rid of Tylenol pills totally? My TSH is 5. I am on 37.5 mg pills for now. Is it too high? So let's talk about women and their hormonal health, especially thyroid, because it can have other effects on other hormonal health as well.
Thyroid is a very important hormone. You shouldn't say you should get off it. It's like when you take thyroid, the other hormones set come in place. So don't do that. Don't have that misconception that you can stop. And that's not a very big dose at all. 37.5 is not a big dose at all.
Not all.
Maybe, yeah, it's on the lower side. It's not, and it's very important that you continue your thyroid medication to keep fit. And many people, moment they get pregnant, they think they should stop. But that's also a very important thing that when you get pregnant, your baby needs your thyroid hormone till it is 20 weeks, and then the baby can produce some thyroid hormone on its own. And thyroid is necessary for many things in the body. For your body, well, your metabolism. Once you stop that, your metabolism will be low. You'll put on weight. You'll be lethargic. You'll be depressed. All that will come in. And when the baby, when you are pregnant, never stop. Many a times we need to increase the dose of L-toxin. Okay, because that's the time when you need more of toxin with your thyroid levels, and then increase your dose. And the baby's development, mainly the mental neural development of the baby, depends on your thyroid. So don't. And sometimes you may hike it up, and the moment you deliver, you may come back to a lower dose. Many times we feel there are some people, like what she asked, they have some antibodies, TPO, what we call. If the antibody is positive, their dose fluctuates. I think your endocrinologist will help you. Sometimes you may need a little, sometimes you may not need, and you may stop. There are some people who do stop, but they have some other way. But on the when you talk for the normal population, when you take it, you should keep taking it and not stop, because it does a lot of good to you. If you stop, things reverse back and all hormones get damaged. It's like a thing which sets other hormones in place.
Yes, yes, yes. And agar Momita, it may help you. I've been on a thyroxine for last 35 years plus. So it's the way to take care of your health. यार किसी ने आपको पहले ही अगर पता कर लिया है आपने और आपने थायराइड पे काबू पा लिया है, तो उसको छोड़ने का मत समझिए. Please continue your medication, and that's what Dr. Anuradha Garu is stressing out on. Well, next question, I think Dr. Bhuvaneshwari ji, you also can add to this, Dr. Anuradha ji. Shabana, 23-year-old, please suggest how to manage my stress eating and cravings. I am stressed and I tend to eat a lot, and this is affecting my my weight. So 23-year-old, I think the stress is again from exams or pressure of work, etc. Dr. Bhuvaneshwari first.
Definitely, you can eat more, not more of high calorie foods. Prepare nice
Okay.
salads, have fruits, make some nice dish, colorful, which you can eat like a salad or a fruit salad or different varieties of salads. You put little boiled chana, moong in it. Like that, I'm not telling you should not eat if you have stress, but eating should not be only the thing for stress busting. They don't
Hmm.
know if they, even if they can't step out, close the door, blast the music and dance for a while. You see how your stress comes down. Seriously,
Wow.
children who
Wow.
study, if you can't step out to go for a walk, just blast the music and dance. You'll feel much, much better end of the dance. So food should not be only for, food is the not the only thing for bursting stress. Second, eat low calorie foods more. I'm not telling don't eat. Eat low calorie foods more. Second, prepare something nice, colorful. Put it in a nice glass bowl. The colors can be seen. Such things which will pep you up when you're
Yes, ma'am.
stressed. This is my
So
way of telling.
last time, one of your sessions that you said, if next time that you're craving for something, go cook for yourself, nice special dish. And I've taken that word to the T, and I now enjoy cooking as well. That's become my stress busting activity.
I know
So thank
you like something in some way. You need not eat what is made by the others. If you like a crispy dosa, make it crispy. That doesn't mean you have to pour oil. You
So
can
you
still
know
learn
that
to make
time that I cook, that time that I make something for my own self, that snack that I carry for my craving, I am losing that stress as well and that craving to eat as well. So
you're giving
I'm
importance to yourself,
yes, I'm
right?
enjoying it. Thank you for that
Otherwise, you're
suggestion.
always doing for others, not for yourself.
Yes, yes. Thank you. So, Dr. Anuradha, next question is about a very important question. I feel Priya is asking this question: menstrual cups. Are menstrual cups safe and hygienic to use? What do you recommend, pads, tampons, or menstrual cups? I'm glad somebody has asked about it because we are now moving on to more aware societies and where there are a lot of programs which are talking about menstrual cups. So, but there are doubts. कितने सारे doubts रह जाते हैं कि ये safe है या नहीं है? What's your advice, ma'am?
Means she didn't tell me her age. If for very young girls, menstrual cup, we will not say yes. Later one who is married, and because little difficult to introduce inside. Okay, and it protects the environment. That's why it is more user friendly. That's why people say the pads they throw it and pollute the environment. So menstrual cups are better. Use one, clean it properly, and keep it in. How to use it also is important, and it has to be clean. Change at least twice. Clean and then put in, and then after the periods, wash it properly, clean it, and keep. But the age is important. For a very young
Yeah.
girl, I don't think I will ask
Priya,
them
would
to
you want to
use
write down your age
menstrual
as well? Yeah,
age.
I'm asking her
Yes.
to text her age. Yeah. But what age do you start to recommend menstrual cups, ma'am?
Old, I would say after somebody is married, then it is easier to introduce in. The cup is little big and then it gets and get fixed with the suction there. Okay, and using tampons also, you said pads and tampons. Tampons, when one uses, many young girls now use a tampon, little smaller. But one thing with the tampon is they should remember when to, they have to remove it. It shouldn't be left, and once it is lost, it may cause infection. It should be changed also many times. Yeah, because tampons will absorb more. It doesn't soak. It doesn't cause the inconvenience that pad causes. So maybe more youngsters are more towards tampons now.
Hmm.
And but the
So,
menstrual
so
cup is a
while we
good
say
thing. It can be
yeah, bodily awareness and readiness through there are other ways when the cup needs to be introduced. When you say when we are saying marriage here, we're talking about sexual introduction.
active. Yeah, yeah, yeah.
Active
Sexually
sexually,
active
once you're
woman.
active
Yeah.
sexually,
Yes. Yes.
the
Yes.
more of
Correct. Yeah.
awareness
That's what I
around
meant.
your body, and that's where your confidence also
Yes.
develops. Yeah,
Yeah.
done, ma'am. Thank you. And
Because the
next
introitus
question.
will be little bigger to introduce. The introitus will be bigger to introduce the cup because it's much bigger than a tampon.
Yes, ma'am. So, Veena Rudrappa has sent wishes to all the beautiful ladies here, to you as well, Angel. Happy Women's Day. Next question is Sonam Kumari. She is between 25 to 30 years, frequent UTI, that is recurring. How do I prevent this?
That's a very important question. This also, women are some more prone to UTI than men because they have a shorter urethra, and the whole place, like the urethra, the vagina, vaginal opening, and the anal opening, are all close together. And some people also, if you, one very important thing, those who have recurrent UTI, they have to drink more of water. They have to pass urine more often and not store the urine. Number three is when they use they should use their hand first to clean from front to back and not from back to front, so that there's no fecal contamination. Stool doesn't come and get contaminated. And another category of women who get newly married after sexual intercourse, they are more prone for getting
UTI.
recurrent UTI. For them, we have to say they have to use lubricant so that the urethra is not injured. Number two, pass urine before intercourse and after intercourse so that the bacteria, whatever, is flushed out. Those are the important thing. And one more, she says she's 30 or something, so she doesn't come in
Yes.
the postmenopausal age. And even postmenopause also, women have this problem because the estrogen hormone is less, their mucosa becomes more, is more fragile, so they contact the infection, there's more trauma there, so they may need hormone application. For them it is hormone application. For person who just met 28, 30, if they are married, they have to take some precautions, what I said. And with young girls, they get urinary tract infection, see a doctor soon because there may be some problem urinary tract, okay, some
Yeah.
abnormality or something. It should be you get frequent urinary tract infection and you spoil your kidney. So go see your
Okay.
pediatrician. I mean, for different age
Right.
groups,
And that's
we say different. And
very,
one
very
more
important.
last thing is, some people try to do self medication, put a vaginal pessary or some medication, thinking it is urinary tract infection, but they may be having a vaginal infection. Go to a gynecologist, you put in a speculum, and she'll see it may be just a fungal infection because you're diabetic. You have that same burning and frequency during urination, and you think it is a urinary tract, but what you are suffering is a vaginal
Correct.
infection. So,
Right.
vaginal examination also is important for women who have repeated UTI.
Wonderful, ma'am. Thank you so much for throwing light there. Ma'am, next question to Dr. Bhuvaneshwari. Anita Visavajala is 53-year-old female. Intermittent fasting के बारे में पूछ रहे हैं. So, does intermittent fasting, is it safe for women with health conditions? Best way to do it. And secondly, ma'am, I've also read somewhere that intermittent fasting is not for women. Do you agree to it?
I wouldn't say intermittent fasting is not for women. First, for anybody, before doing intermittent fasting, please meet a dietitian with your health
Mm-hmm.
record. Because anybody who's a diabetic, anybody on insulin, okay, anybody who's having other issues like ulcer or something to do with your stomach, can you keep your stomach empty for a long time? Will your blood sugar fall? Okay, so I would say take physician or dietitian advice before starting intermittent fasting. Second, if one thinks I'm doing intermittent fasting and they start eating so much during that window of eating, it's not good. It's how much to eat, what is the total calorie, that matters. And why do you do intermittent fasting? You want to lose weight. Are you doing any activity? Again, let's come back. Calorie in and calorie out both mean a lot. Second, if somebody says I'm doing intermittent fasting, I've lost weight, you need to look at the history. Was he eating too much before? And then what is the window of eating? Has he brought down the calories? Has he increased his exercise? So take proper advice and do intermittent fasting. And it's not for everybody. And I would not say it's not for women or men. You want to do, take advice and do. Are you the candidate?
Correct.
Second, in intermittent fasting also there is lot of differences. Like there are people who eat only within X amount of hours and fast for long, 16, 8 and 8, 16, 12, 12, all that is there. What suits you? Plan and
Correct.
then do.
Absolutely, ma'am. Thank you. And next question is about a daughter. Radha is asking for her daughter, who's 24-year-old daughter. Dr. Anuradha, I think you should be able to answer this. Problem with the acne, hair loss, and also has yeast infection, unmarried. Uh, Well, please advise any tests and supplements that you would want to advise.
How is your period? Is it irregular? And what's the weight?
Correct. So maybe if you're watching, please do text us back. What's the weight of the child and as well as the period ka history. But on a general note, ma'am, PCOD,
Okay,
I think we should
now,
talk about
yeah, that's
PCOD as
what
well.
we should speak of
Neha Mondel's next
PCOD.
question. Sorry,
Hmm.
ma'am, to interrupt you.
Yes.
Neha
Yeah,
is
yeah, yeah.
25-year-old. She also has PCOD and PCOS. How do I regularize periods and also diet, which can help me with my PCOD? Both of you can share the answers here. Yeah. Please continue, ma'am.
PCOD is a condition. How the other person was, lady was asking me. In PCOD, you have weight gain. You may have lot of acne. You may have extra hair. I mean, unwanted hair, I would say. And
The
you
areas that you don't
sometimes
want hair.
want it, unwanted hair. And then what's a repeated yeast infection could be a sign of having sugar. They have something called
Mm.
insulin resistance. Okay, even if they are
Mm.
young, we have them having all that acanthosis on the neck, pigmentation, and acne on the chest, back. Those are all signs. So what she asked me, she should first thing when you say in polycystic ovary, the sedentary life, lack of exercise, diet, these are the most important things. So lifestyle management would be the first thing. I think Madam Bhuvaneshwari will tell us about the diet. If that doesn't work, even a weight loss of around 10% can make your periods regular, can make you better. If that doesn't work, then only we go to the second line for giving you hormones. Okay, and whenever you have PCO, we should be careful because you are prone for having hypertension, diabetes, and dyslipidemia. Lipids also become abnormal. Vitamin D deficiency. So whenever a youngster, now we have that very rampant. So if a youngster comes to us with all these, we have to tell them these are the things you have to do, and we have to do a few tests for them. She asked me about the
Okay.
test, right? We have to
Yes,
do a
yes,
hemoglobin,
yes.
sugar, HbA1c, lipids, vitamin D, a testosterone examination, a ultrasound. That's important.
Hmm. Hmm. So here, Damanpreet is asking an additional question. What is an ideal time to get an ultrasound to screen PCOD, 31-year-old female?
Anytime can be done. We don't, we have to do it after the period. That's a better time to do because you won't have other. When you have polycystic ovary, we can make out any time actually. She can do it just after her periods. There's a better time so that if you have some small cysts and all, they come after the ovulation. So do it after your periods. That would be a good time to do. And if you are,
Yes.
I mean, sexually active, a transvaginal scan gives us a better idea than doing abdominal scan.
Yes. So, Dr. Bhuvaneshwari garu, Telugulo there's a proverb, Samita, Kodi munda, guddu munda ani. Ante we don't know where the trouble has started. Weight gain due to
Okay.
PCOD, you and as Dr. Anuradha garu has suggested, lose weight and then you will get balance of this. So there's this vicious cycle of weight balance which will help both the condition. But you are also unable to lose weight because you are in certain hormonal condition. How do we crack this with diet and exercise?
Of late, as doctor said, we are seeing many young girls with PCO. Is it because it's picked early
Hmm.
or is it prevalent more? We don't know. But when I
Yeah.
run through their lifestyle, I strongly feel lifestyle is causing. How many of them get up in the morning, get little sunlight on them? I'm not telling get up at 4 o'clock, 5 o'clock. Even you get up at 6:30. How many of them look at sun or get sunlight? We don't know. Everyone watches movie late night, go to sleep very late, get up very late, 10 a.m., 11 a.m. I don't understand. I'm telling you, this is the main thing. We are, I'm sure doctor will suggest the hormone flux when it happens. So if you're a person who's sleeping erratically, there is no pattern. So when you get up late, what do you eat? Do you start your day with lunch? So this is what is main lifestyle again and again. And if a mother or father is bringing the daughter, you should hear the stories. The father will say or the mother will say, Madam, I had been telling this. After that, you get up, you don't sleep properly, you eat what is available, or you order what you want to order, and there is lack of activity. I strongly feel, as she said, the first line of treatment is changing your lifestyle. Try that. First, try that, diligently follow for a couple of months. See the weight loss, and then you yourself will feel I'm happy. Second, they will say, Madam, I've enrolled in gym. The next is they think that's the solution. And gyms are very smart. They ask you to pay for 1 year, which should motivate you to go more. That also is not regular, because these people, I will say, first start walking regularly. Make a routine in your life.
Yes, ma'am.
Everything became a routine, and then so I feel the first thing is lifestyle change. Meet a dietitian, plan your diet and exercise, and then see whether it works. Meanwhile, visit a gynecologist who will tell you again, is lifestyle change enough or do you need anything else?
Yes, ma'am. So here, in addition, Damanpreet was asking the same thing. Can we actually cure PCOS?
There, there is no cure for PCOS. Well, it's like it's a what will you say? You can keep it under control. Now, many people we find they have the periods regularly if they do diet and exercise. They don't need any treatment. Okay, once in a while, if again they get back to irregular periods, we do treat them. So you can keep it under control. But most important is if you lose weight, even your sugar will become okay, your lipids will become okay. So that way, you are keeping it very much under control without any medication.
Hmm. Right, ma'am.
So
So
it is
next
more
question,
of
I
a
think
metabolic
also.
disease. Yes,
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 ma'am.
ma'am.
Please
Yeah.
continue. Uh,
No,
Ma'am,
it
I'm
is
running
when
short
it
of
is full.
time. Yeah, sorry, ma'am. Please continue. I'm interrupting you. You finish and I'll
No,
continue.
no, please tell me. It's okay. Maybe you can go to next
Yeah.
question if you want.
Ma'am, Jayashri has painful periods and change in bowel movements that I'm prone to constipation and fissures. I'm having a lot of water, good nutrition, and I have increased my fiber intake. Tips to handle the impact of periods on gut health. Are they connected, ma'am?
First thing, first part of a question was painful periods. Well, gut health, many times we have constipation during periods because of the hormonal change. Yes, it can be there for 1 or 2 days. It's not like throughout the cycle you have it. Maybe you'll have for 1 or 2 days. Take more of fibers, drink plenty of fluids. That is one. This first part was a painful periods. But if a period is becoming normal little pain, that's how I would like to tell the audience. Every ovulatory cycle will give you little pain. Well, because of the release of prostaglandin, periods have to be a little painful. You can take a mild painkiller and things should be okay. And mothers shouldn't refuse. I don't give painkillers. We find always young girls coming. They miss school, not taking a painkiller. Okay. But the other thing is, if pain is progressively increasing, that is not a good sign. We should think of endometriosis sometimes. It is too painful. She
Hmm.
has lot of pain. She has to stop going to work in spite of taking painkiller, or she doesn't uh, go to school because she has lot of pain. Then she needs help. We need scan and to rule out endometriosis sometimes. Now we see that
Oh,
even in younger population. But normal little
right.
pain is okay. And the bowel habits, constipation can happen because of the hormonal A. It should
Oh,
be sometimes in part of the endometriosis also loose motion, going to the washroom too many times during A. That can be a part, but normally I think most people will have a little bit of constipation. Nothing to worry.
right, right. So, Dr. Bhuvaneshwari, ma'am, if I can ask you about fiber and the importance of it, one quick word from you, ma'am.
Increase the quantity of vegetables and fruits. The fruits which can be eaten with skin, thin skin fruits. You can always wash well and then eat it with skin. And avoid juices, take more of fruits. Increase the quantity of vegetables, especially the something like green leafy vegetable, and choose whole cereals with skin instead of the broken. Like dals, choose moong instead of moong dal. Put it simple. And brown rice or unpolished rice is better than white.
Right. All right. So quickly, two last questions that we want to take. One, what's your advice on the Gen Zs? What is an ideal age to attain puberty, given the Gen Zs are getting period very early? Sumitra is asking this question.
There's no ideal age. So usually after 10 years, now we have girls even at 10, 11 getting their periods. Previously it used to be 14, 15. Now it's come down. But if somebody gets period less than 8 years, then they need to see a gynecologist, endocrinologist. That is precocious puberty. But at 10 years, it is very common nowadays. 10, 11 people, most girls do get. And depends
which
on
I'm still
the
unable to
food they
digest.
take.
It's
Yeah.
still very difficult to digest. You being professionals, you must be going through this, but this is a little difficult to digest. Yeah. Next question is, yeah, people are getting married very lately these days, and then their family starting time is also getting delayed. So, how much is this going to affect conception?
Conception actually decreases a little bit after 30. Previously, we used to say, but get married before 30, have kids. Slowly, the quality, the quantity becomes less. Now we put it more around 35 because we find a lot of women getting married a little later. But if you feel it is, you are getting married too late, after 35 and all, you should think of egg freezing or something like that before, if you really want it that way, to delay it so long.
Yeah.
So because the
Okay.
number of, yeah.
Yeah. Dr. Bhuvaneshwari, yes or no, if you can answer. Does papaya affect fertility? In a wrong way, that is.
No.
No, Dr. Anuradha is saying no. So no, Ramanpreet, happily खाइए, ग्लो हो जाइए जैसे आपने बताया, स्किन हेयर के लिए अच्छा है, आपके लिए भी अच्छा है. Go ahead, have papaya. So I think with this we'll have to end our questions from the audience. Dr. Anuradha, with this end of the session, I would want you to give us some good tips to take care of women's health. Top tips, please.
To end, I would say women should be aware. Awareness gives them empowerment. Know about the condition. Get yourself checked. Give time to yourself. Go for a preventive check. Take time out to have good food, to exercise, and at the same time do your pap smear, your mammogram, and other things which has to be done properly. Seek help when you think there is some issues with you. There's nothing wrong. There's always a time to get help and get your condition treated. And always be aware, knowledgeable, so that you can take part in deciding strategies in your family about their health. And when you are knowledgeable, empowered, you empower the whole family. And happy Women's Day.
Wonderful, ma'am. Thank you so much. And one last question that I see Priya is asking, an important question. 30-year-old, weakness after menstrual cycle, and she has beta thalassemia minor. One quick advice for her, ma'am.
After menstrual cycle, if is she bleeding more? That's the first thing. See, when they're thalassemia minor, the hemoglobin is always many a times on the lower side. Even they don't have the disease, they are minors. Their hemoglobin is always a little low. So she should get her hemoglobin and a thyroid done, and see if she's bleeding more. Take some tips so that she doesn't lose more blood. See a doctor, do a scan, your thyroid, hemoglobin, and take some medication to reduce your flow. And maybe you can get your other things checked, vitamin D and thyroid, and take some multivitamin supplement. And we don't give them too much of iron for overload, but if this is very low, we can always supplement a little.
Yes, and Dr. Anuradha Panda can be consulted on Apollo 24/7 as well. Please consult gynecologist Priya and then take care of yourself. Dr. Bhuvaneshwari ma'am, so I want you to give us top tips before you leave. Top tips for our health.
Yeah, please prioritize yourself. Become little selfish. Uh, do not eat leftovers. Prepare your food, what you're supposed to eat, how much, and keep time for your exercise, at least 20 to 30 minutes in a day. And moderation is the key.
Wonderful. Thank you so much. It was a pleasure having you both here because you were empowering. Information, as you said, is power, and that's what you spread today. Thank you again. More power to you, ladies.
Thank you.
Thank you.
Namaskar. Thank you. And that is today's session. Question answer session from your end is done. But from my end, I have 3 questions for you. Health quiz coming up. Health quiz, I'm going to ask you 3 questions. Please hop on to YouTube chat. where you can type your answer and win prizes. This is exclusively on YouTube. If you're watching this on Facebook or Instagram, please jump to Apollo 24/7's YouTube channel. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. Winners, once I take your name, please write back to us at before every Wednesday, so that with all your contact details like name, number, etc., to marketing at apollo247.com, gift vouchers will be shared with you. And the questions for today are on the screen as well. The first question: true or false? Cervical cancer is the fourth most common cancer in women globally. True or false? I repeat the question. Please answer if it is true or false. Cervical cancer is the fourth most common cancer in women globally. Question number 2. Fill in the blank. International Women's Day falls on dash March annually. Every year we celebrate International Women's Day on which date? Fill in the blank. Question number 3. Yes or no में answer कीजिए. Postpartum depression also includes other mood disorders. Yes or no? Postpartum depression also includes other mood disorders. Yes or no? So I'm waiting for your answers. I see you guys typing on the YouTube, but now let me give you coupons quickly. We have overshot by a minute, but please bear with us. Here are the coupons that you can use on Apollo 24/7. Use the code AskDoc150 to consult top doctors direct from Apollo. You get 150 rupees cash back when you use this code. The next one we give you is first 3. You buy Apollo medicines from Apollo 24/7 direct from Apollo. Your order gets delivered within 2 hours and get 25% off as well on online medicine orders. Code is first 3. And the next one is exclusively for you all Health Hour viewers. Use the code HH247, get 199 off on online doctor consultation with Apollo doctors and up to 20% off on medicine orders as well. And you can reach out to Apollo 24/7 on WhatsApp as well if you're looking for medicines. Just a call away or text. You can WhatsApp on 9355247247 to avail all the healthcare services of the app. Next week, we are talking about sleep. See, we've been talking about how the circadian rhythm has affected our health. You got to control your sleep. How do you sleep faster and better, and why is sleep so important to stay healthy? We're going to talk everything about sleep studies. So let's talk about it on the 17th of March, 11 a.m. And here are the winners for this week. The winners are Sumitra Devanand, Simran and Kavita Agarwal. I repeat the winners: Sumitra Devanand, Simran and Kavita Agarwal. Please write back to us at marketing at apollo247 with all your contact details. Chaliye, next week we shall meet you on 17th March, 11 a.m. Till then, thank you so much all of you. Please take care of your health. Prioritize yourself. Namaskar.